live here on Facebook with Holistic Nurse Practitioner Kathyrn Gerber, and we thank you for joining us here today. We're going to wait a couple of minutes, just introduce myself. My name is Darrell Handwerger, Holistic Family Nurse Practitioner. I'm here at South Florida Integrative Health Center, and I'm here with Holistic Nurse Practitioner Kathyrn Gerber. She's going to introduce herself, and we're going to talk today about brain health. That is something that's such a crucial issue with the increase in Alzheimer's disease and with so many people having like a decrease or finding challenging situations with cognition, which is memory and focus. And we're going to talk about the root causes, some of these root causes of brain aging, and apply that to practice and how we can give you practical information that's going to help you start doing things in your life to be proactive with your health and especially with brain health. So, as people are joining, we're going to say hello to Kathyrn and thank you for being here. And so Kathyrn, why don't you tell us a little bit about yourself and what got you to this point, what you do here?
Sure. Thank you for having me. Yeah, I just want to talk a little. So, currently, what I'm doing is I'm a PhD student at the University of Miami, and I'm kind of as Darrell mentioned, we're focusing on brain health, and my substantive area is in neuroinflammation and brain injury. So, that's kind of what I'm researching. I'm really interested in seeing how, what's going on in the brain, the different like underlying physiology of the brain, how that impacts symptoms in TBI patients specifically, and then looking at different blood biomarkers and how these things are all interrelated. So that's kind of what I'm working on right now, and how I got to be where I'm at right now. I worked clinically for a while and just seeing different outcomes for patients and wanting to know more about why certain patients had better or worse outcomes than other patients. And I think looking more into the inflammatory markers and more examining like the symptoms that go along with these is going to help kind of provide more insight into what these patients are going through, and also looking at patterns and what we can see there. And I'm hoping to build upon this knowledge to explore the connection with Alzheimer's disease and also look at holistic interventions that could also be like efficacious in the brain injury population.
That's really, touched upon so many different points that I'm really excited about talking today, especially about that neural inflammation and really very practical, those biomarkers I'm very interested in. And I like the idea of picking up patterns because that is something that's unique or something holistic nursing really does emphasize, is looking at patterns in life and reflecting on those to see how we can improve ourselves or improve our connections with others. So when you say patterns, what kind of patterns are you looking for? That's quite interesting.
You mean in patients, or what we see in
The
terms of
patterns that
analyzing what
you
we're finding?
Yeah, in your research and analyzing what you're looking for, that's gonna key you off with a like alert you to where there might be inflammation.
Sure. Well, kind of going back to the symptom experience of patients, when we're looking at, say, and examining like depressive symptoms, like there's different things that could go into that experience. So like feelings of sadness, like anhedonia, fatigue, like there it might look different for different patients, and kind of examining um, like how that manifests itself, like what you're seeing more, because the depression experience wouldn't be the same for every patient. So kind of looking like, are there different, depending on the nature of the brain injury, are you kind of seeing different outcomes?
Hmm. So you're looking at different conditions that like depression, that could be that something that shows you that there might be something going on in the brain other than maybe just hormone neurotransmitters. Is that like inflammation?
Sure. I mean, we're looking like both to see how it's tied to neuroinflammation. Um, but then there could be other explanatory causes as well.
Okay. And when you say neuroinflammation, could you tell us a little bit more about that?
Um, Sure. So, specifically, in our study, we're looking at different biomarkers of neuroinflammation. And when a patient sustains a brain injury, there's the inflammatory response. And we're examining biomarkers both that are specific to the central nervous system and also more systemic biomarkers. And
Mhm,
so, when a patient sustains a brain injury, the blood brain barrier with the integrity is compromised. And so then you might expect to still see kind of more general biomarkers like IL-6, for example. You might be
mhm,
able to get that even though you're not measuring directly from like the CSF, you could still measure, serum levels and maybe
mhm,
see kind of indicative of the injury that's occurring in the brain, even though you're not measuring directly.
mhm. Okay, that's quite so IL-6 is an inflammatory marker as an example. Any other examples that you might measure as
Yeah, sure.
for
I'm
inflammation?
interested. I'm interested in looking at tau because tau's been implicated in Alzheimer's disease. So, it's another
Mhm,
one. Um, and there's a lot of biomarkers being studied in the context of TBI. So, can't
mhm,
analyze all of them. I'm interested in S100 beta as another one that's been incorporated clinically. Um, GFAP is another one I'm looking at that has really high predictive ability for TBI. And I think it's beyond the scope of this talk to go so in depth about all of the biomarkers right now, but
right, those are some very right, advanced with, markers that I'm not sure even on blood tests at LabCorp or Quest how you would order those. That's very interesting, but about the tau, is that a root cause that these proteins that are formed that might be associated with Alzheimer's, or could be? So, in other words, are we gonna blame it on these tau proteins, or there's something that we could look more deeper, possibly that's what's causing these tau proteins? Maybe it's a response from the body that's a beneficial response, and we're blaming, like similar to cholesterol, where we get caught up with blaming a certain kind of chemical in the body or nutrient in the body, like we blame cholesterol when really it's not cholesterol, it's more of the inflammation of cholesterol. Is that, could that be the same with these tau proteins, that it might not be implicating them, but there might be some other process?
right, yeah, tau it's still I think poorly understood and how it works. I think it has like both beneficial and not beneficial properties that are, still aren't fully understood. And even Alzheimer's disease, and when they examine brains of patients who have experienced Alzheimer's, you're going to see different, like there's tau and like different neurofibrillary tangles and alpha beta plaques and like different proteins are being expressed in different amounts, and then it's just poorly understood at like you know how tau like
Mhm.
specifically is implicated compared to some of these other biomarkers that you see.
That's interesting. So we have still a lot more to learn about those tau proteins and what we need to do about them. Yeah, that's going to be very interesting in the future. Kind of what we've learned again about cholesterol as we developed our knowledge about its kind of its purposes, what it does in the body. That's going to be very interesting. Well, I'm interested about your holistic nursing journey. What brings you to, how do you feel this research that you're doing and that you're so involved, that you're very much involved in, and it's so exciting? How can you apply that to something like holistic, the holistic nursing that you've been a part of and that means so much to you?
Sure. So I think one thing I noticed, as a bedside nurse, definitely, I think that like holistic therapies are not utilized enough for patients. And I think that that's something I would like to see done more. And specifically in cognitively impaired individuals, I think that, even if you can't communicate with words necessarily, if you're using other like holistic approaches, like even aromatherapy or animal therapy or music therapy or my colleagues actually do very involved in music interventions in ICU
Mhm,
patients, and they show like a lot of really positive benefits for those patients. And so I'm just interested in using my research, like the current study I'm doing as kind of a foundational study, and then maybe in the future looking to see at how like holistic intervention work um, can help the symptom experience in TBI patients.
Hmm. Um, how do you feel having that holistic perspective of could really help with brain health? Having that
Yeah,
holistic.
so um just in general, having like a holistic, there's a lot of like mindfulness exercises, like spirituality exercises, things like this that have been shown to improve brain health greatly. And um, out of the hospital context, even, incorporating holistic, things like spending time in nature, like gardening, plants, these sorts of things have been shown to have like
Mhm.
really positive, like neurochemical effects in people too. Um,
Uh-huh. So you say so connecting with the environment around us, and everything from sleep and stress all connects with this, possibly this neuroinflammation, this brain health that we're talking about.
Yeah,
Um,
and another a big one I think is nutrition, and there's a lot now on like the gut microbiome and the gut brain axis connection. So that's kind of another way of like holism affecting brain health and affecting the whole body.
Oh, that's a great point that you bring up, the gut-brain connection and how that's holistic, because it doesn't just break us up into different systems, like current, conventional medicine does. It kind of shows that connection, that there can be other parts of the body, other systems, and how they're just interconnected. And how do you feel that research on the gut microbiome is going to go in the future? How do you see that going? Do you have colleagues, and do you see a lot of research in your arena about
I think
this?
it's a really hot topic right now, and I think that there's a lot that just because there's so many like, the microbiome is very complex with so many different organisms that are, again, like I don't think like completely understood the like, how they work. So I think that's like a really rich area for research, certainly.
Uh-huh. And that really does have a lot of potential for helping people, because now they could start working on gut health, which is going to then help them with their brain health, and maybe vice versa. Do you feel it's a two-way kind of connection here between the brain and the gut?
Yes, I do I strongly believe that, yes.
Oh,
So I'm
okay.
excited to see, yeah, kind of where research goes in the future in that area.
Wow, that's okay. Well, what do you hope your research, I mean, we've talked about it a little bit, but how can it improve, do you feel, or how do you see it improving brain health, your the outcome of your research, or maybe where you're going to go with your research?
Sure, I think that I'm hoping it'll help practitioners have a better understanding of the experience of brain injury patients, so that it'll help practitioners help them better. And I think it'll give us ideas of um, how like the needs of people who are experiencing poor brain health and what we can
Hmm.
do in that area.
Hmm. Um, when you mention nutrition, have you seen a lot of good research on different foods? If you could name your top 5 foods, I know that's always tough. It's a tough question whenever I get that too. But can, could you name the top? Would I be asking a lot to ask you to name at least
Sure. I mean, well, anything with antioxidants is good, to eliminate
okay.
toxins from the body. I know like there's superfoods like kale and pumpkin and other things like that are really, really good and positive for gut health. And just I'm a big advocate for anything from nature. Like I've grown my own food in a garden before, and so like I think like your like less process is easier for your body to process, and it puts less stress on, the gut and the intestinal flora and things like this. So
So that's a good right. Those are and those some of those herbal, they're like, I know in some brain supplemental formulas they put herbs like rosemary, seems to be somewhat beneficial for the brain, and
yeah, I know
basil.
like carrots and beets I think are really beneficial for what is it called? Cognitive, like mental sharpness. I think have
Mm-hmm.
been shown to be really good.
Uh, okay, so you the carrots and beets. What about the fats? Have you really, because the brain is mostly fat, right? And have you found that to be a big player? That is something that's throwing you in your research that you got to kind of keep that focus there about the phospho or these different types of fats in the brain. Is that something that you're really keeping there as your a big part of your research?
Sure. I mean, I'm not looking specifically at like measuring, fat levels in the brain or anything like that, but yeah, I think fat's important for maintaining like a holistic, you know, approach to your body. I think like healthier fats like coconut oil are probably, preferred. Um and I again just kind of going back to the gut brain, connection. I think it's important, to kind of remember if like that will that will influence brain health too.
Right, right. And so yeah, by so eating in a way that helps the gut is going to also right have have benefits for the brain health for brain health. So do you think this big increase in depression and anxiety um has I know it's multi there's so many different reasons it can be, but inflammation can play a role in that?
Yeah, and certain foods are, cause inflammation. So
Mhm.
I think that yeah, if you're increasing the inflammation in your gut, then that could have an influence on what you're seeing in the brain, and then also your mental sharpness and cognition too.
Mhm. So okay, so let's see. Anything you else that you I mean, that we didn't mention that you would like to get a message about, taking care of, some of the top actions, lifestyle actions a person can do to take care of their brain? You besides I mean, we mentioned nutrition already.
Yeah, I think exercise is great for mental clarity. And again, it's going back to like eliminating toxins from the body and releasing, positive neurochemicals. I think
Mhm,
that exercise is huge, and getting enough sleep is also really important. For that's another thing that we're measuring in our patients is are they sleeping? Like how much are they sleeping? What is the nature of their sleep? And so we'll see, kind of what our results are. But I'm expecting sleep to have a big influence on maybe what we're seeing and also on the inflammatory
mm.
markers because sleep is very very important for patient healing, wound healing, anything like that. So I would say that those are a few that I can think of that are very
No,
important.
those are good. Believe me, that's already a lot right there. Um, well, how about in your we've talked about some of these general things, but what do you do in your daily life? You mentioned that you do some gardening. That's good for that you do to make sure that you're ensuring your brain health. Some of your daily things, so we can learn and maybe see if we can, do some of those things also.
Sure. Yeah. I think that gardening, you don't even have to have like a huge yard. You can have like little plants on your patio or something. And that's still kind of, you're still getting in touch with nature that way. I know like being in an urban setting, I just try to, observe the nature I am seeing. Like if there's water, if there's a sun, if there's, a tree, even just like touching the tree can like release like positive,
Hmm.
chemicals too, just the way that your body relates to nature and it's the environment around it. So again, I think exercise is very important for me. And it helps me to focus more than when I'm sitting down focusing on something because I've had kind of an outlet for that. Um, and I think just finding quiet time additionally to practice
Hmm.
mindfulness, prayer, spirituality, like because I think most of us have very hectic lives or are often being pulled in many directions. And I think being in touch with oneself is also very, very important and helps us to perform the rest of our functions a lot better.
Hmm. Well, you've touched on a lot of points, especially when it comes to a the holistic journey. You've touched on a points where one of your colleagues is doing a music interventions, music therapy, art therapy. You touched on some point of other points of things that people can do, such as gardening, different types of exercise. I like that you talked about this mindfulness. It's very important in holistic health and spirituality, having a purpose. These are all extremely important parts of holistic nursing and holistic health. And I do like that you touched on all of that. And I'd like to have you on again so we can really go a little bit more into these holistic practices like art therapy and music therapy, like gardening, mindfulness, and spirituality, and we can really even help people to help other nurses and nurse practitioners and other medical professionals who really want to understand why being holistic in medicine can really help your patients and help your who your help who's the other side across the table is a complex human being with a lot of and it's much more than just breaking a person up into different individual systems. And that's what holistic nursing and holistic medicine is all about. So thank you, Kathyrn. This has been quite fascinating, and we'd love to have you on again. Thank you for taking your time to speak with all of us here on our holistic nursing Facebook page and this Nourish and Food page, and of course the South Florida Integrative Health page. Thank you very much, Kathyrn. This has been very, very informative, and we should keep going forward in helping people and to improve their brain health. And you should have a lot of success and a lot of uh, ability to help people with brain health. It's going to be so essential in the future with this increase of Alzheimer's. So we could help with that, and you could help with that. Thank you very much, Kathyrn, and we look forward to you on for a future live.
Thank you so much for having me. I really enjoyed speaking today. Thank you.
Great, Kathyrn. You have a wonderful day, and thank you, everyone, for joining us. Everyone, have a great, healthy day.